we've been joined by Pauline Phillip to give us an update on winter and current operational performance. Pauline.
Okay, so I think all of the board have got the paper in front of them, and I won't go through every section, but really to give you an overview of where we are. And I'm reporting obviously on the month of December, but to give you a sort of a refreshed understanding of the situation. So looking at what we reported to the board in November and the preparation that we were doing the second or third time round to try and give the NHS a better winter. I think we have concluded that December has gone quite well. When you look at the overall performance for the month, it was better than December last year. But I think the important thing to note there is that we also had an increase in activity. So we were seeing a significantly larger group of people, and we were seeing them within 4 hours. And that sort of follows the trend throughout the year, because if you look back on what has been happening in previous months, even when we have been concerned about that overall metric, when we have looked beneath it, we have seen that our organisations are actually doing more work within 4 hours, and I think that should be acknowledged. Our bed occupancy was a bit lower in December, and I'll come on and talk about some of the things that had helped that. Commenting on the level of emergency admission, again we saw an increase in emergency admissions, and the trend continued as far as zero length of stay. We have previously talked about it being approximately a 10% year-on-year increase in zero length of stay, and clearly that supports the work that we are doing moving forward in the operating plan and what we want to achieve this year with regards to zero length of stay. A number of other things that have supported us during December. The work of the urgent treatment centres, we had 110 of those finally confirmed as having the correct range of services, and clearly that was very important because we were able to book patients in from 111. Our ambulance arrivals, whilst they were in higher during December, we saw a significant improvement as far as handovers, and that's obviously been a very key metric from a quality and safety perspective. And if we look at our 30-minute and 60-minute handover delays, they were down by 25% and 40%. So I think that was a significant improvement, and we saw the ongoing improvement in delayed transfers of care, and we managed to sustain some of the improvements that we had made in 21-day plus patients. Just on page 3, we very quickly mention our elective position, and then I'll talk about some of the out-of-hospital issues. From an elective point of view, and I know this board and NHS England last year were very concerned about us maintaining a focus as far as elective care is concerned. And if we look at our December position, you will see that there's been a further reduction in the overall size of the waiting list, and a further reduction in the number of patients who are long waits, 52 weeks plus. Out of hospital, clearly there's been a significant focus on information and communication, learning the lessons from last year and making sure that we get information out to our patients, to our public, etc., about how best to utilise the services that are available. Our GP appointments, extended access, has been rolled out across the country. I referred to 111 a minute ago, and it has continued to see increasing numbers of patients. If we look at the year to date, I think we're something like 800,000 up on the previous year. But I think really importantly there, the level of clinical input into 111 patients was the highest ever, as indeed were the call response times, etc. So these are all essential components of the transformation of urgent and emergency care. Flu, we have an ongoing focus as far as flu is concerned. The focus during December was on improving our vaccination levels. As far as flu prevalence, the picture, and I'll sort of bring that up to date now, is that it has been essentially flu A, H1N1 flu, that predominantly affects adult patients, and from a hospital point of view, I think we saw the impact of that in HDUs, ITUs, higher dependency units, but not so much in our general adult beds. And indeed we had some very good anecdotal, but maybe a little bit more than that, reports in about the capacity of the out-of-hospital sector in supporting people with flu this year. Our pharmacies, 111, etc. And I think that, again, that's something that we were clear that we wanted to deliver. From a mental health point of view, the work that we have done with mental health colleagues has been very important from a liaison psychiatry impact with, really across the entire NHS. And we've been making significant progress in our emergency departments as far as children and young people are concerned. We still have some focus, we still need to do more about adult patients waiting for beds, but that's an ongoing dialogue. Just to check if there's anything else, I think to remind the board that we have stood up all of our oversight and support arrangements. NEP has met this year to date, fortunately. The purpose of the meetings has really been to update the members of NEP, our Royal College colleagues, our professional colleagues, etc., on what has been happening. And then finally, to mention that we have been very focused, as we were last year, in ensuring that during this period we don't take our eye off the ball from a transformation point of view, because it's the work that we do on transformation that gets us into a better place, not just in winter, but every day of the week, every month of the year. And I think we have held true to that. On the final page, we've just drawn out, for the benefit of the board, some of the things that we are focusing on moving forward that supports that transformation agenda.
Thank you,
That's
Pauline.
it from me.
I think we should, before I open it up, I just think we should mark, as the snow has been falling even in London today, how hard staff across the country are working now,
Yes.
that they're absolutely in the middle of this. And we should acknowledge the superb job that teams across the country are doing in providing, high quality care to more people and deliver better operational performance year on year. And also to thank you and your team for the support that you've given them. I think
Thank our staff.
you're doing an excellent job. Can I open it up? Ara, do you want to?
Well, I couldn't say more. You've said it, Chair. Congratulations. I'm sure
we have rough
your,
days ahead.
Yeah, but beside your wonderful leadership in this, we're halfway through winter.
Yeah.
I'd love to know, when you should never ask questions when things are going well, but 70 million savings, 700,000 people more in A&E, a 30,000 reduction in the waiting list. What's the recipe for this? In terms of, could we learn something from, most people say you learn from failures, but we also need to learn from the success. What's the recipe here that we should? Is there something we've learned from this that we can actually communicate to the provider organisations, or are there variations and so on and so forth? Sorry.
Well, I suppose the first thing to say, of course, there is variation across the system, but I think we do, and I spend a lot of time, as you know, out and about in our organisations, as does Ruth and Kathy and colleagues. And I think I can honestly say that what I see this year, not just at a provider level, but at a system level, is much more sophisticated working. So I think there's been a lot of joint working. That has been helped by some of the resource that has gone in, especially from a local authority point of view, the capital resource that went in to support some of the things that we have done. But I think where we see the real change is that the processes, people have developed a learning attitude towards looking, and we tried to focus this last year to say, look, let's look at some of the challenges we faced, let's learn from them, and let's be sufficiently brave to try things out and change them if they don't work. That, you know, we need to be a constantly learning NHS. I think the level of clinician engagement across the NHS through the work that we did last year with NEP, and NEP actually continued to work with us throughout the year behind the scenes, and I think that that has absolutely helped us. But I think the real focus on having the vision, the transformation, and working towards that. And, you know, I find it just so rewarding, I think is the only word to use, is when you go into an emergency department that was probably in a really difficult place a year ago or 18 months ago, and you see that they are on a journey and they may not have arrived at their destination, but things are very different, and what it does for staff morale in those settings, etc., and for the team working. So I don't think there's any one thing, but I think we have to keep learning. We have to recognise that things do go wrong and learn from those things. But I think keeping the focus on transformation, the overall vision, so people know where it is we are aiming to get to, and I think all of that has helped.
Tim, you wanted to come in.
Yeah, thank you. I just wanted to emphasize, kudos to the management and the whole workforce. What I hear you saying is, slightly better than last year, with higher volumes, is considering what we were concerned about 3 or 4 months ago. That is indeed good news. Without transformation, this is falling on the backs of the provider workforce. So a huge shout out to the providers who are taking on this extra work. As I look at the descriptions of the transformation, which is, as you point out so beautifully, critical to making this so that we're not simply accommodating to an inherently unstable and unsustainable situation, is there a plan for, from an analytic point of view, tying changing processes and the characterization of changing processes to actually improved performance? So I know this is a tricky thing to do, but from a board perspective, at some point we will need to move from anecdotes of transformation to, as you mentioned, variation and accounting of changing processes, and how that accounting of changing processes actually results in improved performance. So I'll hold there.
So I think my response to that would be, Tim, if you can hear me, that for all of our core transformation programs, we have quite a systematic way of collecting data and evaluating where we are going with those, and we would be really happy to share with the board the metrics around them. I think there's a slightly broader point as well, insofar as we introduce different models of care, we, at a professional level, at a managerial level, and at a public level, we need to be able to communicate the impact of that. So I suppose one of my little examples would be same-day emergency care. We've seen a 10% increase in same-day emergency care in the last year, and that stat is sort of easy to mention in the board, but we need to be able to communicate that outside these organisations, across the NHS and to our patients. because their expectations need to this is probably the wrong way of putting it, to say that they need to change, but they need to understand that the model of care that we can now deliver is significantly different to what it was 4 or 5 years ago, when people basically turned up at an emergency department and they were seeing in majors, minors or resus, and that was it. That we now have a whole array of urgent and emergency care services, and we have alternatives to traditional admission, and that this is all part of the picture. And I think that on the back of the 10-year plan, these are things that we are actively talking about as to how we use those metrics to communicate what's happening from a service development point of view.
Thank you.
Aaron?
I think there's another element here which probably is more related to us than the service, and that is the narrative in the last quarter of last year was very different than the narrative of the last quarter of the year before, where we were on top of all the CEOs in terms of their financial performance. I mean, that was a very, very hot. I don't know, some board members here will remember from the previous, you're nodding there. It was a very different story. The leadership style and approach was very different. And I think that was a very positive signal in terms of getting on and dealing through the demand rather than the digging on the money side. And I must say that quarter was very uncomfortable even in the board.
Pauline, when is the appropriate time to schedule a discussion here on, I hesitate to say this in the middle of winter, but to review those lessons learnt? Because I do, as you rightly say, we mustn't take our foot off the gas. This problem doesn't go away unless we keep transforming. When would be most helpful to bring this back?
So we're doing something similar to what we did last year. Last year we did our review of winter sort of in 2 stages, because I think it was the first time that we had approached it in this fashion. So last year the first thing we did was a bit of an international review of, have we got the recipe right? And then we collected data, and we involved our stakeholders in giving feedback on what went well, what didn't. And we pulled all of that information together. I would say it was probably during April, May. But I think the only thing I would hesitate on is we're trying to create an atmosphere where we're learning all the time, and that we're reviewing now what's happened in December, and constantly also looking back to last year, because at the moment we're facing a new challenge for this winter, i.e. cold weather. For the last 2 weeks things have been very challenging because of those weather changes, so it's looking back to last year and learning what works. So I think the overall answer is a full review in the spring, but happy to bring learning to the board on an ongoing basis as well.
That's the right way forward, isn't it? Cathy?
Just a quick thing, so I completely echo everything Pauline's saying, and Pauline and the teams have done fantastic, incredible work, and we do feel as though we're in a lot better place. The one thing I would affect, and as Pauline says, we're all out and about visiting places, is if you were in a trust, you'd make sure that you didn't just look at the totality, you were diving into specifics. And the one area I think that you sort of mentioned, variation was mentioned, and I think we need to make sure, and we know there's variation, we see it, but in terms of thinking about the experience and outcomes for every single patient, I don't think as a board we should ignore, we should make sure we keep our focus on. So it's the, although everything has been really well managed and everything, there's always a possibility that at the far end, every single patient is not quite where we would want it to be, and that has to be the ambition really, that we keep that really focused on patients. So.
Definitely.
Yeah, very, very well said. Good. Anything else? Well done, Pauline. Thank you.
Yeah, thanks.
Very, very good. Good update. Are there any AOB items for the public session? In which case, I will open it up to see if there are any questions from our members of the public who are in the audience. No? Okay. in which case we will draw the formal public board meeting to a close, allow the audio-visual people to remove their kit. And could we just take a sort of 10-minute break and get back together again at sort of 2:05, try and recoup a bit of time? Is that all right? Brilliant. Thank you.